Hello and welcome to Baby and Rojas Orthodontic Specialists. The purpose of this video is to show you step by step how the Invisalign process works once we receive your trays. So please sit back, relax, and enjoy the video. Congratulations! You have now officially started your treatment. Throughout this video, you will learn how to care for your aligners and how to effectively progress through your treatment. You will notice there are tooth-colored bumps on your teeth now. We call those attachments. Those are going to allow your trays to clip onto your teeth and are a very important part of tooth movement while in the clear aligners. If you ever notice one is missing, please contact our office and we will add time in the schedule to your next visit to bond it back on. Your clear aligners have letters on them to indicate whether it is an upper or a lower tray. For an upper tray, you will see a U. And for a lower tray, you will see an L. To put your trays in, I find it helpful to start at one molar. Clip them in over the bumps, and as you move tooth to tooth, continue to clip them over the bumps all the way to the other side. Never bite your aligners in place. That can cause them to break, crack, and also if you're biting them into place, you could be biting them where the plastic is above the attachment and the tray could break off your attachment. So always clip them on with your fingers, getting them on all the way around, making sure that they're sat down fully over the attachments and that you don't see a gap between the tooth and the tray. So we should never see this, where it's down almost all the way, but that you can see a gap between the tooth and the tray. You will be using Chewies 2 times daily to achieve effective tooth movement as well as to help your trays seat as snug as possible. Chewies come in a long version and a short version, and are to be used for 10 minutes 2 times a day. The long ones can be held in between your teeth using your hand and biting and squeezing at the back for 5 seconds to the next molar, biting and squeezing to the next tooth, biting and squeezing really tight, moving around and biting and squeezing all the way around, and continuing to do that for about 10 minutes, 2 times a day. Whereas the small Chewies will just be put in your mouth like a piece of gum and just chewing on that, putting pressure between the Chewie and the tray. The Chewies are reusable, and at every visit we will be evaluating your Chewie use and making sure it's 2 times a day and asking if you need any more of them. Trays are to be worn 22 hours a day and taken out and put into the container when eating, brushing, or playing sports. Trays are to be taken out a very specific way. If this is your upper arch, you would use your right pointer finger and you would go inside at the molars on the left side and you would pop the tray down. Then you would use your pointer finger on the left hand and go inside on the right side of your mouth, pop the tray up so that it's sitting up on all the molars. And then you would use your finger and pull the tray out from the inside. It's very important never to take your tray out from the outside. Most people want to get their finger on the outside and pop it and take it out. But what can happen is the tray can get bent, distorted, or broken that way. So just as I said, when taking out an upper tray, you would use your pointer finger and cross over to pop it down. Pointer finger on the opposite hand and cross over and pop it down. And once everything's lifted, then go from the inside and pop it up. Now for the lower, you will actually use your pointer finger and just go in the same side. Whereas the top we went over, on the lower we will go the same side and pop the tray up. And that was very easy, but pop it up on that side and then go in with your pointer finger, pop it up on that side, and then from the inside, take it out. At each appointment, we will be checking all of your attachments and just making sure that all of the bumps that are put on your teeth are still there and that your tray fits properly and you're using your chewies, and if you're asked to use elastics, that you're using your elastics as well. And then we will be giving you a number of trays to get you through to your next visit. You will see these have numbers on them. Right here is 25. This would be tray number 25 of 55. So in this particular case, there are 55 trays in total for the first chapter. And the number here is very important to be followed. So 25, then 26, then 27, 28, etc. Be very careful never to get them mixed up by putting, say, a 28 tray in instead of your 25 tray. If you're starting at number 1, be very careful that you're always going 1 to 2 to 3. Your tray wear will depend on your treatment. It can range from weekly changes to 2 weekly changes. Sometimes we do 10 days, sometimes 5 days. That will vary, and we will decide when we do your bond how often you will change your tray. If you were to go into tray 1 the day that we delivered your trays, if this said 1 on it, if it was weekly changes and you got your tray 1 on a Monday, then the next Monday you would go into tray 2. And then the next Monday after that, you would go into tray 3. And etc. until we see you for your next visit. Always keep 1 tray previous to the tray that you're in, just in case anything was to ever be lost or broken. Never go without a tray. Always make sure you wear the tray that's previous to the one that you're supposed to be in, and call us and we'll order the tray that you lost or the one that broke. The day of the appointment that you receive your Invisalign trays for the first time and your attachments are bonded on, you will receive a kit that will have a battery toothbrush for brushing your teeth and a manual toothbrush as well for helping keep your trays clean. A little lid for your manual toothbrush just to keep it clean, floss, and toothpaste. When cleaning your trays, you can just use your manual toothbrush and either water and baking soda or toothpaste and water. Just give them a good clean inside, rinse them, and then shake off the water and put them back into their container. You'll always keep your container in a room temperature place, nothing too hot where the tray could get heated and distort the shape of it. In your kit that you will receive the day of your bond is a card that sits inside of the case here, and it is just very important reminders to brush inside of your liner after every meal, and that you can use toothpaste or baking soda with cool water. Don't use too hot of water. That could change the shape of the tray. As well, the aligners can be soaked in a diluted optic white mouthwash for 2 to 3 minutes. The optic white Colgate tooth mouthwash looks like this as its container. It is a clear mouthwash that doesn't have any colors. A green or a blue tinted mouthwash would pick up the color on your trays. So as well, on this little card, it does say use your chewies and wear your trays 22 hours a day. Very important things to follow. The day of your bond, you will also receive a bag like this. And inside of it is your case for your trays. So when your trays are not in your face, they're in the case. So whenever you take out your trays to eat or drink or play sports, they're to go into this case after they're rinsed with water, and then the excess water is shaken off. Inside this case as well is a little book that just reiterates all the key points. Wearing your aligners for 22 hours a day, removing your aligners when eating or drinking anything, cleaning your aligners each time before putting them in with a soft bristled toothbrush and water, and brushing and flossing after you finish a meal. And if you don't have a chance to brush, at least minimum is rinsing your mouth out with water really good before putting your trays back in. I'm going to show you some crystals as well that can be used for keeping your aligners clean. And they are actually have to be purchased through the Invisalign accessory.com, and they can be purchased online through there. The cleaning crystals are right here, and I'll review how to use those in just a moment. And inside of this box as well, if you lift up this, is a booklet that has all of the use and care instructions. And it just goes through everything that we're going through in this video. If you decide you want to use the crystals on a regular basis for cleaning, a sample is found in your case, and there are instructions inside. And it just says that you would remove your trays, rinse them under tap water, and place them into a container with 100 milliliters of water. I'm just showing you it's not that much water. When your trays are in the water, you would just shake for 20 seconds with this in it. Shake it for 20 seconds and then let them sit for 15 minutes. And then after the 15 minutes, shake them again for another 20 seconds, and then take them out and rinse them, shake them, and you're good to go. If your trays do not seat all the way down, please take the tray off and look inside of the tray. Sometimes there can be a tiny piece of plastic just sitting down at the very bottom there, and if so, just flick it out and try seating it again. And if it seats, then we're great. If there is a piece, like an edge of the tray, that is irritating your lip, you will just use a nail file and gently file it wherever it's bothering you, just to smooth the rough edge. And then you're good to go. When brushing your teeth at nighttime, we do recommend that patients use this Prevident 5000 Plus toothpaste. It is a high-strength fluoride toothpaste. It gets brushed on the teeth for 2 minutes, and then your trays go back into your mouth without rinsing with water. And that just strengthens the teeth. This toothpaste is usually found behind the counter at the pharmacy and won't be on the shelf. But this will just strengthen the teeth so that they stay nice and strong during the duration of the treatment. If ever you do get a filling done during treatment, it's very important that you take your trays with you and have the dentist adjust the filling so that the trays still fit. Invisalign is like a chapter book. This starts your first chapter, and at the end of your 41 trays, you will receive an x-ray and a scan and a photo, and we will assess if you need a second chapter, or a third, or a fourth. The end. Some Invisalign cases will require elastics to progress through the treatment. If your Invisalign requires these elastics, we will show you how to put them on and take them off at the end of your bonding appointment.